So when we're talking about intergenerational trauma, we're talking about intergenerational trauma and intergenerational poor mental health, because the two are very closely associated. And when an individual experiences trauma at any stage in their lives and also gets mental health problems, when they become a parent, that can have an effect that is then transmitted to their children, not inevitably and not irreversibly. But you can see how we get into a cycle where that can then have an effect on their children, which lasts into adulthood. They then become parents, and on you go.
When I first studied psychology and I did my degree, it was, is it nature, is it nurture? And what we really understand now is that it's both, and your experiences in life actually can alter your biology, and not just the biology of the person exposed to trauma, but the biology of their children and their grandchildren. I think there's been some really lovely work that's come out the last 2 decades from a researcher called Rachel Rehuda in America, where they followed up mums who were pregnant during the 9/11 World Trade Center attack. And then they followed up babies who were in utero, whose mothers were exposed to that event. And what they see is those babies are born with a kind of an altered stress response system. Those babies are more difficult to soothe. And then as they follow them up longitudinally into childhood, they see kind of higher rates of behavioral problems, higher rates of emotional problems in those babies. And when they look back, they see that it's the mother's symptoms of post-traumatic stress disorder and depression that actually explain why those children show elevated problems. Rachel's also done some really beautiful work with Holocaust survivors and looking at the children of parents who were exposed to the Holocaust. They're older adults now. Following them up, they see, again, altered stress response, higher rates of immune problems, higher rates of inflammation, higher rates of cancers and metabolic diseases. So, and when they look back at those children, they see that the children of Holocaust survivors were themselves also exposed to more maltreatment and trauma during their infancy, and that is linked to their parents' traumatic symptoms as a consequence of the Holocaust.
We're born social creatures who are picking up all the time from our environment around us. So for that learning to be optimal, the environment around the infant needs to be as safe and secure as possible. If that environment isn't safe and secure, that can begin to impact on how those neural networks are developing in the infant's mind during these first 24 months.
From birth, what babies need in order to both feel safe and for the development of their brains is what we call a serve and return relationship with their primary caregiver, mums in our society generally. In this serve and return, baby does something, gives a cue, and within seconds, mum responds. So, for example, if it's crying for food, mum gets some food or reassures that she's off to get some food. Or baby may be signalling through a smile and gets a smile back. And that sensitive response to baby's cues is what we call nurturing care.
And if we don't have those interactions, if that kind of back and forth between parent and child, that consistent, contingent interaction between the mum and the baby or the dad and the baby is not there, then that can adversely affect that child's longer term development in terms of their social behaviour, their emotional development and their behavioural development.
I find it useful to think of 6 core features that you see in adults who've been traumatised when they were children. So the first one is that they're going to be on the lookout for danger. So they'd be hypervigilant, anxious. The second one sort of follows from that, which is that they have a tendency to have very dramatic mood swings that can be quite short-lived and very often are triggered by things that they may be aware of, or they may not even realise that those triggers were there, and you certainly may not realise. So these may be inexplicable, sudden, intense changes in mood, which can be anxious mood, angry mood, low mood, and so on. And then thirdly, children have this amazing ability, if they can't escape physically from an unpleasant situation, to shut off mentally. It's a protective thing, but if you do it a lot, you carry it into adulthood, and you have this tendency to just switch off mentally if things are getting too stressful or difficult. And then with very, very intense mental pain, people find ways of trying to get rid of that. For example, by inflicting physical pain on themselves. And so deliberate self-harm is an absolutely typical feature of a response to trauma. And another way of self-harming is to abuse drugs or alcohol. Again, very typical of people who've suffered early traumas. And people also describe very intense mental experiences. So not just thoughts and emotions, but also visual images, hearing unpleasant voices, and of course, if you're asleep at night, nightmares. And finally, also very understandably, and actually very easy to detect, is that they just don't trust other people. And you can see why. If the people who you should have trusted to protect you from danger didn't do so when you were younger, then why would you trust anybody, particularly people in authority or who may be there trying to help or to nurture you?
So when they pick up that somebody's maybe not listening to them, they can go back into that survival mode and think, okay, well, I just can't trust this person, and so might put up a barrier between them and that individual.
So, how are you feeling?
Yes, fine.
And how's it all been going then? Are we in any pain?
I've already explained the pain to the nurse.
Okay, yes, I can see that you had mastitis and you're on antibiotics. Right, well, it can take up to 10 days. Let's see, here you go. It's all quite normal. One of those things that affects many women. A tight bra can affect
I don't know why I have to go through these appointments. Complete waste of time. You won't do anything just like the others. They all let me down. So what's the point? Why am I even here?
And how are you feeling in yourself? No sadness? No, you're all good, aren't you? Okay. All right, just jump up on the table and we'll get your blood pressure sorted. I've just got a few more questions.
Even tiny changes in how midwives and other health professionals approach women and treat women can have a massively positive impact on their journey through care, prenatally and postnatally.
I hear you telling me you're absolutely fine, but it looks to me like you're in pain. Now, I see from your notes you've had mastitis. Now, I know that can be very, very painful. So how's it feeling at the moment? I can see you're finding it really hard to talk to me. I wonder if maybe you think I wouldn't understand you, or I might not be able to help you. But if you can give me just 5 minutes, maybe we can talk it through. Okay?
Okay, yes.
If we think of childhood sexual abuse as an example, the prenatal period, the physical examinations, the stress that can come with that, if midwives and other healthcare professionals aren't aware of that trauma history, they can unintentionally trigger traumatic memories, they can trigger flashbacks, stress responses, and also that can lead to women avoiding prenatal appointments because they avoid the stress that those appointments can trigger.
It was my 20-week scan, I think. It was my first one. I was a bit nervous, but also quite excited to see the baby. You know, just hoping everything was okay.
I'll just be 5 minutes, okay, love? If you just pop yourself on the bed and get yourself ready. I'll need to take a look at your tummy, okay?
We also work closely with our midwifery colleagues, encouraging them to adopt trauma-informed practices.
Gosh, you look upset. Are you okay? Take your time. Breathe slowly and deeply. I can see this is really difficult for you.
I'm so sorry. It just came on. It feels like like the past.
Don't be sorry. It makes perfect sense. Have you ever experienced flashbacks?
Sometimes.
Yeah. That can happen sometimes when something reminds us unexpectedly of a trauma from our past. Is there anything that I can do or say right now to let you know that you're safe?
Thank you.
The research we've been conducting post-COVID is really to address the gaps in the evidence base and to think about the intergenerational transmission of traumatic experiences, but also to study the conditions linked to trauma exposure, so PTSD, complex PTSD in particular. So the majority of women that we're studying in this longitudinal study are under the care of mental health services. They're being treated for mental health conditions, but PTSD and complex PTSD are highly undetected, with complex PTSD diagnosed by interviews and questionnaires are not actually being treated for these conditions within services. They're being treated for other conditions, often depression and anxiety, but then they're not being asked about their exposure to trauma, and they're not being offered evidence-based treatments for PTSD or complex PTSD. And that can have implications for their long-term mental health and well-being and the long-term mental health and well-being of their infants. Often these mothers stay in mental health services, or they might kind of be discharged, and they come back, and this is what is often referred to as the revolving door patient. And sadly, you know, women can be in mental health services for way longer than they need to be because we're not detecting, screening for, and treating the right conditions.
Someone with childhood trauma may have coped with being very self-sufficient or being very independent. So as a new mum, they might look like they're very organised and have it all together on the outside, but on the inside can be really struggling with a lot of crippling self-doubt.
Of course they're judging me. I can see what they think. No, I'm not going in. I know I'm not a good mother. I'm a terrible mother. They'll all see that. She'll cry again and again, and they'll all look at me. Oh, they might take her away. No, I can't face this. I don't deserve to be a mother. Why do they find it so easy? No, I'm not going in.
There are many things we can do to help. So there are interventions out there that can change that trajectory. So if a parent has an untreated mental health condition, we can treat the condition with psychological therapies and sometimes pharmacological treatments, but also we can intervene at the relationship level between that parent and the child. So there's interventions like video interaction guidance, for example, that really promote attuned, sensitive parenting. And when we show parents the successes they have in their relationship, when we build on their strengths, we see that parents do that more and more. And that can really heal that relationship that's been disrupted by parental mental health problems early on. And that can have a positive impact on a child's long-term development, reducing their risk of mental health problems.
Stop. Just breathe. Oh, look, Bethany. Jo, the nursery nurse. Hi, Jo. She said she'd be here. Oh, she was so helpful doing the big work. I was actually okay. Yeah, I am good enough. Come on, Bethany, you and me. Let's give this a go.
This is actually the first time that science has given us this knowledge and an opportunity to break this cycle that's going on. And of course, we can reduce mental health problems, particularly in parents, and we can reduce adversity or trauma in early childhood and indeed during pregnancy.
The treatments that we have available are very successful. There's a lot of emerging and growing evidence to support this as well. And by treating the impact of trauma, we can begin to break the cycle.
Understand as much as you can about what these effects are. So read about them. Don't avoid it. It's scary, but also it's empowering. You can actually start to do something about it.
It's been great to see over the last 5 to 10 years, particularly the kind of the emphasis on trauma-informed care, where we might screen for trauma. We might be aware that maybe some of the behaviours we might not understand people are displaying are actually linked to trauma exposure. But that needs to be expanded much more. It needs to be expanded across physical and mental health care. It needs to be expanded into midwifery. It needs to be, much more recognised in mental health services. And we need to move away from the question of what's wrong with you towards what's happened to you, and asking people themselves to maybe tell us why they think they're experiencing the symptoms they are, rather than us assuming we may know.
I think all of us in society need to be more aware of these effects, these intergenerational mental health and trauma effects, and we need to be more nurturing of parents with young children, more supportive, and every one of us can do that, and collectively we absolutely must do that for the benefit of generations to come.